hard to think of an area of medicine that changes as drastically and dramatically as infectious diseases. And so we are committed here at Indiana University to providing a great area for people to train, to emerge from our training program, our fellowship in infectious disease, ready to face new challenges and new realities related to infectious diseases.
The wonderful thing about medical training here is that you take what you like from each attending that you work with, and it's, it really helps build your own style of practice. And I think I'm gaining so much by working with different people.
I have been at IU for a long time. I came here for medical school and for residency, and when I was thinking about fellowship, I was thinking that it would be time to go somewhere new, but as I went through the interview process and looked at other programs, I realized that this was actually the best fit for me, and I think that comes down to the people that are here. Everybody in the division is passionate about teaching, really great to work with, really supportive of trainees.
I went to school here, residency, fellowship, and then stayed on as faculty. Despite our size, I was actually able to find kind of more individual attention if I were able to seek it out. And then I think another thing that kept me here in those experiences of support was not necessarily support from the system, but support from the faculty that I worked with. Some of them I've been working with since I was a medical student in the areas of research. Those members of the faculty that kind of worked with me early on in my career actually supported and fostered that interest, and especially in research, and also what helped keep me here.
I feel like if you're interested in clinical infectious diseases, this is probably one of the best programs to go to, because you get such like a broad experience. I mean, you get to work with the veterans at the VA. We work with an underserved population, Ashkenazi, and like a lot of variety there. And then at university, we get to see people with really complex disease and transplant and hematologic malignancies and stuff like that. So there's a lot of different exposure. And then also at Methodist Hospital, there's more of a kind of private practice model as well. So you can kind of get that feel of like what it's working in the community.
If you still want to live in like a metropolitan area, I think Indy is a good option. If you want to live in more like suburban areas, or if you have like a family or something, there's lots of options there too. And there's things to do here. We obviously have the race. That's kind of like the big event over here. There's, parks, there's museums, there's, day trip things that you can do that aren't too far away either. So there's plenty of stuff to do in Indiana.